Alright, so I'm checking off my Airway bag in the morning, and I'm going to show you a couple things that you should make sure that you have for the day. Obviously we want to do a thorough check of the rig, but there's a couple items that we absolutely want to make sure we have as far as the Airway kit goes. Now when I open up my blue Airway kit, there's a couple things I want to identify. I want to make sure that I have a laryngoscope blade handle. I want to make sure that I have my blades. And we know the most common sizes for adults are going to be the 3 and the 4, so we want to make sure we at least have those with the Mac and Miller, but it's good to make sure we have all those blades as well. It's also a good idea to make sure that your blades are working, that they're nice and bright. Nothing's worse than going in to intubate and having a bulb die on you. Trust me. Up in the top right pouch, a couple items I like to keep is 1, a nasal cannula for doing apneic oxygenation. 2, make sure you have your end-tidal CO2 adapter for the monitor, and then make sure you have a tube holder. These color metric devices, I don't really care about these. We obviously want to go through our tubes and make sure we have the common sizes. We actually want to make sure you have every size, but specifically the 6.5, the 7.0, the 7.5, and 8 are going to be the most commonly used during an adult intubation. Most important items is going to be the bougie, and this should be located on the same side of the bag as the intubation kit. And the bougie should be kept long and straight like this. You don't want to keep it curved, otherwise you're going to get some unnatural bends in it. So this should be right here, going in the bottom of the side pocket on the green bag. We want to make sure that we have this PEEP valve here. This PEEP valve is very important. There's a lot of patients that are going to be dependent on positive pressure for oxygenation, so make sure you have this. I've had a lot of people ask me, how does the PEEP valve work? How do we set this up? So what we're going to do is when we take our BVM out on the distal tip, you're going to pop this cap off right here, and then you're going to stick your PEEP valve right there. And this is going to allow you to add positive pressure to the ventilation. Now, we know that we can increase the FiO2 to increase the pulse ox, but you don't have to increase the FiO2 or the oxygen concentration as much if you add this PEEP valve on. And if you look right at the top here, you're going to see we can adjust the PEEP by how far down we turn this. So you can see if I want 10 a PEEP, I'm going to put it right there. If I want 15 a PEEP, I'll just bring this down a little bit. This is very important to make sure you have this on your ambulance. We want to make sure that we have our rescue airway, which is going to be our combi tube. Make sure this is all intact. We're going to make sure we have our McGill forceps, a set of oral and nasal airways. And then lastly, I want to make sure that we have plenty of oxygen in our portable tank. So we'll check this to make sure that it's full. And we can see that this one is at 2,000, so it looks good. We've got our stethoscope, and then we have our crite kit in the top pouch, and then our CPAP mask in the other top pouch. The other thing I like to have is a tongue depressor, and this is actually recommended to us by Jim DeCanto, an anesthesiologist from St. Luke's. But this is really nice because I can go in and I can push that tongue out of the way. So I can push it off to the left, and it'll help me sweep that out and assist it when I'm doing direct laryngoscopy. So thanks for watching Lifestar Rig Chat on the essentials of the Airway bag. Check back next time for more tips from inside the rig.